to review the peripheral vascular assessment. So not only are we looking at actual blood vessels and pulses, but we're also looking for any other signs of perfusion as well, like skin and nail color and condition. We always recommend starting with the upper extremities and then moving to the lowers. And of course, we start with inspection. So start by inspecting the arms and comparing them bilaterally. Is one more swollen than the other? Is there any edema? What color is the skin and nail beds? Are there any lesions? Is there hair where there should be hair? Then you want to palpate. Feel for the temperature, texture, and turgor of the skin. If there is edema, is it pitting? Press one finger into it to find out. We also want to press down on the nail beds to check capillary refill. You should see that color return to the nails in less than 3 seconds. Now we can check our pulses. There's 2 main pulses you check in the upper extremities, the brachial pulse found in the medial elbow and the radial pulse found on the wrist in the groove just below the thumb. Make sure you're comparing these bilaterally and giving them a score from 0 to 4, 0 being absent, 2 being normal, and 4 being bounding. An absent pulse is never normal, so if you need to, get a Doppler, verify whether it's truly absent before you call the provider. Next, you can move on to the lower extremities. Basically, look at all the same things. Inspect the skin color and nail beds, look for lesions or ulcerations, and look for edema. If there is edema, is it the same bilaterally? Is it pitting? Make note of hair distribution. Any kind of venous insufficiency can cause a lack of hair growth and dark discolorations. We also want to look at the vasculature. Are there any tortuous veins? A really common place to find those is behind the knees. You also want to palpate temperature, texture, and turgor as well. And then you can move on to pulses. There's 3 main pulses we check: the dorsalis pedis on the top of the foot, the posterior tibialis, which is along the medial malleolus on the inside, and the popliteal, which is behind the knee. Again, check that they're the same on both sides and give them a score. Then finally, you can check the capillary refill on the toes. Should also be less than 3 seconds. Now you'll notice the nurse took off the socks. You guys, you cannot properly assess peripheral vascular system without actually visualizing the feet, okay? That's so important. So if you do note any abnormalities, make sure you assess the details and report them to the provider, especially if they're new. Poor perfusion is nothing to mess with. So that's it for the peripheral vascular assessment. Now go out and be your best selves today, guys. And as always, happy nursing.